Now the second component, and the only organ of cardiovascular system, is heart. Heart is a muscular organ that pumps blood throughout the circulatory system. It is considered as the hardest working organ of the body, although it is only about the size of a closed fist. It is considered so because the heart performs an amazing amount of work over a person's lifetime, beating an average of 70 to 80 times per minute. The heart beats approximately 100,000 times each day. Let's look at its brief anatomy. The heart is a pumping organ that is located medial to the lungs. The bottom tip of the heart is known as its apex, and the top of the heart is known as the heart's base. For our better understanding, we can divide it into right side of the heart and left side of the heart. Where right side of the heart has two chambers, right atrium and right ventricle. Right atrium is a thin-walled and low-pressure chamber. Then comes right ventricle, that is a thick-walled chamber. It acts as a pump for pulmonary circulation. Here, right atrium receives venous, deoxygenated blood via two large veins. First is superior vena cava, that returns venous blood from the head, neck, and upper limbs. And second is inferior vena cava, that returns venous blood from lower parts of the body. Right atrium then communicates with right ventricle through tricuspid valve that prevents backward flow of blood into atrium. From the right ventricle, pulmonary artery arises that carries the deoxygenated blood from right ventricle to lungs. This movement is controlled by pulmonary valve present between right ventricle and pulmonary artery. Now move towards the left side of the heart. Left side of the heart also has two chambers, left atrium and left ventricle. Left atrium is a thin-walled and low-pressure chamber, whereas left ventricle is very thick-walled chamber that acts as a pump for systemic circulation. It receives oxygenated blood from the lungs through pulmonary veins. This is the only exception in the body where an artery carries venous blood and vein carries the arterial blood. Blood from left atrium then enters the left ventricle. Here a bicuspid valve is present between left atrium and left ventricle called mitral valve. Left ventricle then pumps the arterial blood to different parts of the body through systemic aorta. The valve present between left ventricle and aorta is called aortic valve. Valves present between atria and ventricles are called atrioventricular valves. So mitral or bicuspid valves and tricuspid valves are atrioventricular valves. These valves open only towards ventricles and prevent the backflow of blood into atria during ventricular contraction. And those moon-shaped valves that are present between ventricles and pulmonary or aortic trunk are called semilunar valves. So pulmonary and aortic valves are semilunar valves. Semilunar valves open only towards the aorta and pulmonary artery and prevent the backflow of blood into the ventricles. Now, after understanding the anatomical structure of heart, we will try to learn about the actions of the heart. Actions of the heart are classified into four types: chronotropic action, inotropic action, dronotropic action, bathmotropic action. Where chronotropic actions are those that change the heart rate, or they are actually concerned with the frequency of heartbeat or heart rate. Normal heart rate ranges between 60 to 100 beats per minute. This action is of two types: tachycardia, or increase in heart rate when it is above 100 beats per minute, and bradycardia, or decrease in heart rate when it is below 60 beats per minute. Next is inotropic action. Force of contraction of heart is called inotropic action, or we can say it determines the intensity of cardiac cycle. It is of two types: positive inotropic action, or increase in the force of contraction, and negative inotropic action or decrease in the force of contraction. Next action of heart is dromotropic action. Dromotropic action is the conduction of impulse through heart, in which cardiac nodes play their role. This action can also be positive, in which velocity of conduction increases, while in negative dromotropic action, velocity of conduction decreases. Next one is bathmotropic action. Bathmotropic action is the excitability of cardiac muscle. More the excitability, more will be the cardiac output. It can also be positive or negative with increase and decrease in excitability respectively. So this was all about the second component of blood, that is heart.